kind of the core of the mystery.
That's right. The exact trigger is still elusive. But the leading idea, the main hypothesis, is that it starts with some kind of infection, maybe bacterial, maybe viral, in someone who's susceptible.
And the infection just sticks around or leaves lasting damage.
Yeah, it seems like the initial infection doesn't fully resolve. It kicks off this persistent chronic injury to the gut lining. It really highlights how an initial hit to our gut environment can spiral into a long-term issue.
Okay, let's dig into those theories. One big one is bacterial overgrowth, right? What does that involve?
The idea there is that certain types of bacteria, specifically toxigenic coliform bacteria, think Klebsiella, some E. coli strains, and Enterobacter, start growing excessively in the small intestine.
Where they shouldn't be in large numbers.
Exactly. They're in the wrong place. Or there are just too many of them. And crucially, they produce toxins, enterotoxins, that directly damage that delicate gut lining. It's the toxins do the harm.
Right, bad bugs making poison in the wrong spot. Makes sense. What about viruses? Any theories there?
Yes. Another angle is a persistent viral infection. Maybe someone gets a bad case of viral gastroenteritis, like from rotavirus, or maybe even a coronavirus, and instead of clearing up completely.
It just lingers somehow.
Or it triggers a chronic inflammatory response that just keeps going, keeps damaging the gut lining long after the initial virus should be gone. A sort of viral hit and run that leaves chronic damage.
Interesting. But it's not just infections coming in, right? You mentioned nutrition plays a role too.
It does, sort of in perpetuating the problem. Chronic nutritional deficiencies themselves can make things worse. Take folate, for example.
Okay.
If you're chronically low on folate, your gut lining can't regenerate properly. It's constantly renewing itself, normally, but without enough folate, it can't repair the damage effectively. So the injury sticks around, maybe gets worse, it fuels the fire.
A vicious cycle. And what about our own immune system and all this?
Well, the fact that there's so much inflammation points to the immune system being involved. It's possible the body's reacting abnormally, maybe overreacting to the bacteria or their toxins, or maybe to the lingering effects of that initial infection.
So the immune response itself could be contributing to the damage.
Yeah, instead of